Charting Your Course, a guide to analyzing state policy studies. My name is Elizabeth Stone. I'm an instructor at the Rutgers Center for Health Services Research and the Robert Wood Johnson Medical School, and a collaborator on with some of the OPTIC team. A few logistics before we dive in. We are recording this session today, and it looks like I just got a notification that we're recording. And the recording and the materials will be posted on the OPTIC website in the coming days. So I know a couple of people are posting the opt to leave early. This will be accessible to you later. And if you're interested in the materials or in learning more about OPTIC, the website can be accessed using the QR code on this slide. During the session today, please feel free to post questions in the chat. We will be monitoring and answering questions as we go, and we also have time reserved for questions at the end. Presenting today during this workshop will be Megan Schuler and Beth Ann Griffin, both at RAND, and myself. And we'd like to start by acknowledging our funding. So this work is supported by a P50 Center grant from NIDA. And we'd also like to thank our many colleagues who have contributed to this work. And I will especially call out Max Griswold at RAND and Liz Stewart at the Johns Hopkins Bloomberg School of Public Health, who were listed on the title slide and helped us put this material together. We have three main objectives with this webinar today. First, we want to review some of the many analytic methods that are available and new in terms of evaluating state policies. And then in thinking about how to choose which method is appropriate for the work that you're doing, we will showcase a decision tree framework that highlights key decision points in deciding amongst the different methods. And we will walk through an example using a simulation tool that can also be used to help aid in choosing between different methods in your own research context. So in more of an outline format, we have kind of four main sections of this workshop. So first, we'll set up the context and the motivating part of state policy analysis for this work. And then we'll dive into the overview of several different analytical methods, and we'll walk through the decision tree and the simulation tool. So starting with setting up some context. Policy research can take many different forms in terms of the level and type of policy examined, the content area, the question of interest, the data that you have available, on and on. And for the purposes of this workshop, we're going to be focusing on policies that have been implemented at the state level. We're going to assume that we have access to annual state level data over the course of several years. And being an opioid policy center, we will be focusing on opioid related policies and outcomes. But many of these methods and challenges really apply more broadly. And there are good examples in literature on topics including gun policy, environmental interventions, COVID-19 protections, etc. For those who do work in areas related to opioid policy, this is likely a familiar graph depicting increasing opioid overdose deaths over time in the United States. This graph oftentimes depicts what is referred to as the three waves of the opioid crisis. The first wave, which on this graph goes from 2001 to about 2010, is characterized by a steady increase in overdose deaths related to prescription opioids. Here, that's the natural and semi-synthetic opioids in the dark green line. The second wave from about 2010 to about 2013 is characterized by an increase in deaths involving heroin, which is a grayish blue line. And then beginning in 2013, there's a sharp increase in opioid overdose deaths involving fentanyl in particular. And this is in a dark blue line. And by the time COVID hits in 2020, which is highlighted in blue, fentanyl-related deaths make up the vast majority of opioid overdose deaths, and rates of overdose increase at an even steeper rate during the pandemic. So even as overdose deaths have continued to increase, federal, state, and local governments, health facilities, insurers, and many other groups have adopted policies in attempts to decrease opioid overdose deaths. And we can generally group these policies into four overarching buckets. So first are policies aimed at reducing opioid prescribing. These are policies targeted at the supply of prescription opioids and generally aim to limit the number of people who are exposed to opioid prescriptions in the first place. Examples of these policies include limits on the day's supply that can be prescribed. So, for example, limiting opioid prescriptions for acute pain to a 7-day script. It includes policies related to the disposal of unused prescriptions, physician education on prescribing, clinical guidelines, such as the 2016 CDC guidance on opioid prescribing, and insurance coverage for non-opioid pain management options, such as physical therapy. The second bucket is policies aiming to reduce opioid misuse. These policies are aimed at reducing the risk of potential harms related to opioid prescriptions, more than kind of limiting their prescribing itself. This bucket includes policies related to prescription drug monitoring programs, or PDMPs. These are programs that prescribers can check a patient's controlled substance prescription history. And in some states, there are policies in place that mandate either prescribers to register with their PDMP or to check the PDMP prior to certain prescriptions, such as an initial opioid prescription. This also includes efforts around drug reformulation, pain clinic regulations, sometimes referred to as pill mill regulations, which require pain management clinics to register with the state and meet certain administrative and patient care requirements, and insurance pre-authorization for opioid prescriptions. In the third bucket, we have policies related to treatment and recovery for opioid use disorder, or OUD. And these include a variety of policies largely focused on reducing barriers and increasing access to medications for opioid use disorder, or MOUD. And this includes expanding MOUD coverage by insurance and mandating substance use disorder benefit coverage. Physician-targeted policies, such as the recent removal of the X waiver, which had required providers to go through additional training, and also limited the number of patients that they could see for prescribing buprenorphine for opioid use disorder, and also reducing patient barriers for MOUD. And so many of the policies adopted during COVID-19 fall into this category, including policies that allowed patients to begin MOUD treatment over telehealth appointments instead of requiring in-person visits. And then finally, we have harm reduction policies, which aim to reduce the negative consequences associated with drug use. These include policies expanding access to naloxone, which is an overdose reversal drug, drug testing strips, and Good Samaritan laws, which protect people seeking medical assistance for someone experiencing an overdose. And so we can see, kind of even just thinking of actions that could be taken at the state level, there's a huge amount of variety in the policies that can be adopted in addressing the overdose crisis, both in terms of what the policies are aiming to do, and the details of the policies and their implementation. So for example, even just focusing on a day supply limit. Is this a 5-day limit? Is this a 7-day limit? There's a lot of flexibility and variation in how states are implementing these policies and in the combination of policies that are adopted. And so if we're interested in understanding the effectiveness of just one of these policies, we can really start to see the complications that we have to untangle. One of the issues in policy evaluation is that we typically have to employ an observational study design. In most cases, policies are not randomly assigned and are, in fact, often adopted because of some important characteristic or characteristics of the state. And if we didn't account for those characteristics, this would bias our estimate of the policy effect. One example, which we have highlighted here, is that states with higher opioid-related mortality may be more likely to adopt opioid-related policies. So the map on the left shows opioid mortality rates by state in 2018, with the darker red indicating a higher overdose rate. And we can see clear heterogeneity, kind of with New England and into the Midwest having higher rates of opioid overdose deaths. And on the right is a map depicting the timing of adoption of policies allowing for naloxone dispensing. And here, the darker red states are the states that adopted the policy most recently. And what we see is that many of the states with higher overdose rates actually had an earlier adoption of the naloxone dispensing policy. And so just looking at it like this, we might think that earlier adoption of naloxone was associated with increased overdose death rates. Another complication in policy evaluation is that policies are not enacted in a vacuum. States adopt many policies that could impact, in this case, opioid overdose. And in some cases, there might be many policies that are passed together, kind of in a bundle, especially in a time of crisis. And as we noted before, policy adoption is not random. So prior work by the RAND team highlights the correlation in policy adoption. Here, depicting states that had PDMPs, naloxone laws, Good Samaritan laws, and medical marijuana laws in place in 2015, 2016, and 2017. So in visualizing the policy adoption in this way, there's several patterns that are easier to see. And a few that I'll highlight are that PDMPs are in the blue, are pretty ubiquitous. They are in every state except for Missouri during this point in time. Another pattern is that states that have Good Samaritan laws, depicted in pink, also tend to have naloxone distribution laws in yellow, and that states in the South adopted both Good Samaritan laws and naloxone distribution laws in 2016. While early adoption of medical marijuana policies in green were clustered in the Pacific, Mountain, New England, and Mid-Atlantic states, and early adoption of Good Samaritan laws were clustered among states along the coast. So again, just more kind of correlation in how and which policies are adopted. So with all of this complexity in mind, let's transition into the motivating example for today. In this workshop, we're going to be focused on naloxone standing orders. Access to naloxone as an overdose reversal drug is an essential tool in reducing opioid overdose deaths. And naloxone standing orders are policies that allow anyone to be dispensed and to carry naloxone regardless of whether that person has an individual prescription from a provider for naloxone. And while we won't go into detail on this today, exactly how we define a standing order policy and therefore what states are included as treated states has important implications for estimating policy effects. And a prior OPTIC workshop from the Addiction Health Services Research Conference that talks more about this issue can be accessed through the QR code here on this slide. In our case today, we will be using annual state-level data from 1999 to 2017 to estimate the effects of state naloxone standing order policies on overdose deaths. So on the left, we have a graph depicting state fatal overdose death rates from 1999 to 2017. We can see that generally overdose deaths are increasing across all states over time. And I want to highlight that our outcome here is any overdose death. It is not an opioid-specific measure, and this is because this outcome is available in the publicly available CDC Wonder data. And then again, our policy of interest is the naloxone standing order policy. And we can see in the right that we have staggered adoption, or that states are adopting this policy at different points in time, beginning in 2010 and going through the end of our study period, 2017. And here we've classified these policies as being in place for the first year that they are in effect for more than 6 months. So for example, if a state adopted a standing order policy in September of 2013, they are considered to be in the 2014 cohort of implementers. And by the end of our study period, 44 of the 50 states plus Washington, D.C. have a standing order policy in place. As of August 2020, all 50 states had some form of naloxone access law, though not all have a standing order policy. So it's of particular interest for us to know, does this specific type of naloxone policy effective in reducing overdose deaths? And so with this context in mind, I'm going to pass it over to Megan, who is going to take us into the overview of analytical methods.
Thank you. I should be presenting here now. Now, yes, we're going to transition into talking through specifics of different analytic methods. And we're going to start with the basic or classic difference in difference, or DID model. This model has historically been common in the econ literature, but has seen a lot of growing interest in the past decade or so in the health services and health policy literature. So many folks on this call, I'm sure, are familiar with this approach. And broadly, this model may be applicable when you have at least two groups of policy and a control group and at least 2 time periods. It's commonly estimated with what's known as a 2-way fixed effect model shown here. So on the left-hand side, we have time-varying observations of our outcome of interest, so fatal overdose rate in this case. And I is indexing at the state level, and T is indexing time. Then on the right-hand side, we have Z, which is a time-varying indicator for state policy. So in this case, an indicator for whether or not the state had a standing order naloxone access law in a given year. And then we have 2 fixed effects. One is a state level fixed effect, and the other is a time fixed effect. So the estimate of interest is alpha, the coefficient on the policy variable Z. And the state level fixed effects help account for baseline differences across states in terms of overdose levels. And the time fixed effects basically model overall national temporal trends in overdose levels. And although the basic diff and diff model does not include covariates, you can additionally include a vector of time-varying covariates to further control for potential state-level confounding, as well as to increase precision of the effect estimate. So we're going to walk through some figures that will hopefully help to illustrate what exactly the diff and diff estimator is doing conceptually and how it gets its name. So right now we're starting off with the most simplistic version where we literally have 2 states, a policy state and a comparison state, and outcomes measured for each at only 2 time points. So if we start in 2019, neither state has adopted the policy. And at the beginning of 2020, one state adopts the policy. So we have a post-policy observation point for the state. And then we also have a comparison group that did not implement the policy, who we've observed in 2019 and 2020. So for starters, we can calculate, as shown here, a pre-post difference for the treated state. But this isn't our effect of our estimate of the treatment effect, because we can see that the comparison group also experienced a change pre-post, and essentially due to factors other than the policy, since they didn't implement the policy. So presumably some of the change that we observed in the treatment group was also due to factors other than the policy, which we want to back out from our final treatment estimate. So here in the comparison group, we've also calculated this pre-post difference. And so in order to do that, essentially, we rely on the parallel trends assumption. So we're going to be assuming that the observed pre-post change in outcomes in the comparison group is a good proxy for the unobservable counterfactual outcome for the treated group, which is basically what would have happened to the outcome in the treated group if they did not adopt the policy. So again, that's a hypothetical unobservable outcome for the policy state that we don't get to see. And the change in the comparison group, again, can kind of be thought of as the secular trend for how this outcome is changing in general, even without the policy. So another way to think about this parallel trends assumption is that we're assuming a homogeneous or uniform secular change across states in the absence of the policy. So based on this assumption, Oops. So based on this assumption, we, oops, sorry, having a little bit of lag here. Okay. I think I'm back. Okay, so using the parallel trends assumption, we then obtain our actual diff and diff estimate by subtracting the observed pre-post difference in the comparison group from the observed difference in the policy group. So hence the name difference in differences. And again, the idea is that we're essentially isolating the true policy effect by subtracting out the secular change due to other factors that we're estimating using the comparison group. So we know in practice that we rarely have just two states and two time points. That's kind of a toy example. More commonly, we may have something that looks like this, where we have multiple repeated observations for the treatment state, both before and after the policy, as well as similarly repeated observations for the control state. And when we apply a difference in difference estimator in this context, we're going to be using the same general approach, but now the pre-post change is calculated as the difference between the average in the post period and the average in the pre-period. And again, the classic diff and diff model here is assuming that the outcome trend, i.e. the slope, in the treatment group, had it not adopted the policy, would be the same as the slope in the control group. So really the policy effect here is assumed to be an instantaneous level change and not a slope change. So overall, the classic diff and diff model generates a single point estimate for the policy effect, assuming that the treatment effect is not time varying. So a notable extension to the classic difference in difference model is known as an event study design. So one component of an event study design is the inclusion of leading indicators, which model trends during the pre-policy time period. So these leading indicators are indicators for pre-policy time points. And it's possible to interact these leading indicators with the treatment group indicator and test for significance. And this is a strategy that can be used to assess whether the treatment groups have differential trajectories in the pre-period. And sometimes this may be confused as a formal test of the parallel trends assumption, but we want to underscore that the parallel trends assumption is that the treatment groups do not have differential trajectories either in the pre-period, nor would they in the post-period if the treated group had not adopted policy. And so that's, again, an assumption regarding hypothetical outcomes that is fundamentally untestable. So if you fail to reject the null hypothesis of these interaction terms with leading indicators, then you have concluded that the groups don't have differential trajectories in the pre-period. But again, at the risk of being redundant, that test would not provide actual support for the inherently untestable parallel trends assumption. So similarly, you can add a series of lagging indicators, which are indicators for each post-policy time point. And this can be used to estimate time varying or dynamic treatment effects with interactions with the policy indicator. And so this approach would actually allow you to estimate time-specific policy effect estimates, thus relaxing the pretty restrictive classic diff and diff assumption that the treatment effect is constant over time. So in terms of terminology, a full, quote, dynamic event study design would include a full set of both leading and lagging indicators. And just a couple of points to keep in mind in this context. In general, attributing observed effects to the policy of interest may be less plausible when you get many years out from the policy adoption date. And also, this approach still assumes that the dynamic treatment effect is uniform across states, not unicorn. And so it would not address treatment heterogeneity across states, only across time. So now moving to the most complex and also very common setting in which we have multiple policy states who actually adopted the policy at different times. So as Elizabeth already alluded to, this is often referred to as staggered policy adoption. And so this figure here shows that state 1 adopts the policy first, and then subsequently state 2 adopts the policy later. And we also have a control state that never adopted the policy. And so hopefully this figure begins to illustrate that things start getting a little bit more complex when you have staggered adoption. So for instance, it becomes less clear what is the pre-policy period and what is the post-policy period, and also what is the control group. So specifically, if we think about this middle time period here, where state 1 has adopted the policy, do we view state 2, who does not yet have the policy implemented, do we view them as part of the control group? Or do we only use the control state that never adopted the policy as the comparison for state 1 in this time period? So kind of quote unquote historically, difference and difference analyses did not really focus on this issue of staggered adoption, because even if your data is formatted like this, you can simply apply the classic diff and diff two-way fixed effects model. It will run, it will give you a policy estimate. But recent work by Andrew Bacon Goodman, for instance, Callaway Santana, among many others, have really highlighted kind of the mechanics and complexities of the staggered adoption case, and that we have to think a lot more clearly about the interpretation of diff and diff in this setting. And specifically, so there's been a flurry of methodological work in this area in recent years. And so recent papers have shown actually that for the classic diff and diff two-way fixed effects model to give you unbiased results in this case of staggered adoption, you actually need an additional assumption that is of homogeneous treatment effects across states and time. And so that may not be reasonable. And so this recognition of the issue of heterogeneous treatment effects has really, again, kind of spurred methodological development in this area to propose alternative diff and diff related methods that can, in fact, handle staggered adoption with heterogeneous treatment effects. And so again, to kind of two common violations of fully homogeneous treatment effects. Again, you may have treatment effects that are dynamic across time. So maybe the policy effect kind of grows in strength in years after implementation, or conversely, it may wane. It may have been much more effective at the beginning and then kind of diminish in effectiveness multiple years after implementation. But if you kind of have this same, the magnitude of this dynamic effect is the same across states, then an event study approach can help address this type of dynamic treatment effects. But alternatively, you may have another type of treatment heterogeneity in which the treatment effects actually vary depending on when or where the policy is adopted. So, you know, you may have early adopting states, and, you know, as Elizabeth alluded to, when it comes to naloxone or many of these opioid-related states, maybe the states that have really higher overdose rates and are kind of the worst hit at any given time are the early adopters, and so they you may see a different magnitude of policy effect among early adopter states versus later adoption states. And so that type of heterogeneity would not be addressed by a event study approach, but indeed would be addressed by the kind of genre of recent diff and diff based methods that specifically are designed for staggered adoption and heterogeneous treatment effects. So kind of conceptually, what these methods are generally doing under the hood is stratifying the data into policy cohorts. So groups of states who adopt the policy at the same time, and then implementing a series of difference in difference type designs on each cohort separately. So then within a given policy cohort, there's only one pre and post, pre-policy and post-policy period. So that addresses that kind of ambiguity. And then, so you can estimate the policy effect for that cohort, and then the next cohort, and then the next cohort. And then you can combine optionally all of those cohort-specific effects into an overall policy effect. And so these methods are really useful in terms of being very much more transparent about the actual comparisons that are being made at any given point. And so this is a non-exhaustive list at the bottom of the slide of diff and diff methods for staggered adoption. We're going to be showing the method proposed by Callaway and Santana, but there are certainly multiple others, including some listed here. And there are some subtle differences between these approaches. That's not really our focus today, but generally there's a lot of different analytic choices still within this framework regarding which is the comparison group. Again, this issue of do you choose the only the never treated states, or do you also include the not yet treated policy states? And then there's also choices on exactly how you're calculating group differences and averaging them across time. So the different methods vary in some of those choices, and there are some useful tutorial and review papers that delve more into these details, and I think we can try to post the link to some of those in the chat. But for a few more details on the Callaway-Santa Ana approach specifically, so again, this approach is essentially yielding a series of group time or cohort time effects. So for instance, for the, say, 2016 cohort, we have an average 1 year out and 2 years out, etc. And the same thing for other cohorts. And then these group time specific estimates can be averaged a variety of ways. So for instance, you can weight each cohort effect by the number of treated states. Also, the Callaway-Santa Ana method is a doubly robust method, which is a commonly used type of approach in observational studies when the exposure is not randomized. So basically, in addition to your standard outcome model, a doubly robust approach also adds in a model for the exposure. So in this case, we estimate a propensity score model for the state adopting the policy of interest, and then include propensity score weighting in the outcome model. So doubly robust means that we will obtain a unbiased effect estimate if either the propensity score model is correctly specified or the outcome regression model is correctly specified. So in this context, we would estimate propensity scores separately for each cohort using only baseline data, so covariates measured before that cohort's policy implementation date. And as we're about to walk through, this method is implemented in R in the DID package. So now to get into the actual case study data that we're going to be using to show some code samples throughout. So again, in this data, the policy of interest is naloxone standing order. The outcome is fatal overdose rate from CDC. We have a covariate included of state unemployment rate. Our unit here is at the state level, and our time is the year level. And so just to start off with, we want to take a deeper look at the policy cohort structure, which is an important first step in general when doing a policy evaluation study. So here, again, we're looking by year at how many states adopted the naloxone standing order law. And we see in 2010 and 2013 that we actually only had a single state. But then in 2014, 2015, 2016, and 2017, we had multiple states adopting. So now this is some actual R code, and all of this is included in your case study. We sent the data and the full code. And so in terms of implementing the Callaway-Santa Ana method, you need the DID package loaded. And then this is the, and highlighting here very critically that for this method, we actually are dropping the 2010 and 2013 year because it requires that your cohort size be greater than 1. So here our treatment group variable is coded as a cohort. So indicator, so the untreated, never treated states get a 0, and then for the treated states, there this variable is actually coded as the year of policy adoption. And then this here we specify kind of using standard R model, regression model formatting, the covariates of interest. This is an option that I was alluding to about who is going to comprise your control group, whether it's never treated or not yet treated. And then to get the Callaway-Santa Ana method, you specify DR for doubly robust in the estimation method. And so just to look at some output here. So this will, again, estimate for each of the 4 policy cohorts, 2014, 15, 16, and 17, year-specific estimates. We see that most of these are not actually statistically significant. It will also display these results graphically. And so the red is pre-policy and the blue is post-policy estimates. You can also aggregate in these estimates somewhat differently. So you could request estimates by length of exposure to treatment. So 1 year after policy adoption, 2 years after policy adoption, etc. And so that is kind of the R output and overview. And then similarly, just wanted to highlight that this approach is newly implemented in Stata version 18. And so this is essentially the code here. And similarly, you can aggregate effects by cohort, aggregate effects by year, the same aggregate effects by years exposed to policy, and you get a similar sort of graphical output. I think I'm passing the baton at this point.
Give me 1 second. I was going to say, Megan, there's an interesting question in the chat. If I go back to it for a second, about can you speak to some of the new literature that has come out after Callaway and Santa Ana and the paper saying that potential negative weights created by not accommodating staggered adoption timing won't actually cause bias in the final estimates? It's in the middle of the, yeah.
So, I mean, I think that if there are truly homogeneous treatment effects, I'm not exactly sure which paper this person is specifically referring to, but it is possible that if you have homogeneous treatment effects and not heterogeneous treatment effects, that even with these negative weights that sometimes can occur in the estimation, that your overall treatment effect will be unbiased. But if they wanted to link to any specific papers, that could be helpful.
Great, thanks. Thank you. Can you see my slides okay for the next section?
Yep.
Yeah, and I appreciate everybody using the chat to ask questions. That's the best way for us to kind of manage the questions, and then every once in a while be able to field questions to who's ever presenting. So I get to talk about synthetic control methods as well as use of autoregressive modeling. So first, talking about synthetic control methods. these were originally developed for the case where we only have one state that implements the policy. And they're kind of really theoretically beautiful methods, very commonly used in this space. Because basically what it's trying to do is use weighting, using all the control states you have available to come up with a good weighted version of the state that's actually enacting the policy. And the basic idea behind it is that you are going to upweight states that have pre-policy trends who are most similar to the state enacting the policy, and downweight the states that are the most dissimilar. And of course, the hope is that when we go through the estimation of the weights, that we actually come up with good weights in the process. Just like the methods we've been talking about today, all of them have a core assumption. And for the case of synthetic control methods, we need to assume that the synthetic controls, once we estimate it, actually make a good counterfactual experience for what would have happened in the treated states had they not actually enacted the policy. So to illustrate the method in a better way, of course, okay, so to illustrate the method in a better way, I like this use of this graphical illustration of the synthetic control methodology. So we're going to start on the left-hand side, and our x-axis is basically showing what happened between 1970 and 2000. The y-axis is the per capita cigarette sales in packs. And we're basically going to be looking at California in particular, because they enacted Proposition 99, which was a tax on cigarettes. Increasing tax for cigarettes. And then in the dashed line, you basically see what happened to the rest of the US. So as we might expect, over the series of these several decades, in general, sales for cigarettes were going down everywhere, but we can definitely see that California was unique. They definitely had on a much steeper decline, it appears, potentially. And then, of course, just in general, they had lower per capita sales than the rest of the US. So if we don't try to fix these gaps that occur in the pre-policy, pre-treatment period, then the rest of the US is not going to represent a good counterfactual for what would have happened to California had they not implemented the policy. So what synthetic control method hopefully is going to do here is basically move the dash line closer to the California line. And that's actually exactly what does happen in this classic case study involving cigarette sales and the passage of Proposition 99. If we move to the right-hand side graphic, we can see that our synthetic California, where we've basically upweighted the states that are most similar in terms of the pre-period trends and downweighted those that are not, we actually get really good overlap in the pre-policy period, where our synthetic version of California looks almost identical to California. So this is a case where the synthetic control method actually worked out excellent. And what that helps us say as our core assumption is that then if we go and look post-treatment, post-policy implementation, then that dashed line, we can feel better about it representing the counterfactual experience for what would have happened to California had they not implemented the policy. And we feel better in this post-treatment period about the difference between the lines representing the effect of the policy. Of course, there could be unobserved confounders or other things we might need to worry about, but this is a really nice illustration of a successful implementation of synthetic control methods. Now, there are various benefits and challenges to this method, just like with everything we're presenting today. One of the reasons a lot of folks really do like synthetic control methods is that it makes us separate our design and analysis phase. And so that means that we spend a lot of time making sure that we do a good job balancing the counterfactuals, the synthetic controls versus the state that implements. So you spend your most amount of time kind of saying, did I do a good job there? And if we did, then we can feel good about the outcome analysis. We're not trying to data fish or p-hack or anything like that. Like, we're really trying to keep these two pieces separate. And you can do a pretty good job depending on how many covariates you have. Like I don't even think you need that much pre-period data, depending on how predictive your pre-periods are. The challenges, of course, is like I showed you a really successful example of synthetic control methods, but honestly, I've done this a couple of times in practice and it doesn't always work out that cleanly. So there's a lot of great estimators out there for trying to get high quality synthetic control weights, but sometimes your data might not cooperate. And I think a lot of times if you end up with poor synthetic controls, it can be a moment to kind of pause and say, maybe we're extrapolating beyond the data, maybe we have overlap problems and we should really remove some of the controls or try to figure out, it just kind of forces us to take a pause and think about how we might actually model the data a little bit better, or if we should be trying to get at that particular causal effect. So in spite of that, today I'm going to go ahead and showcase a particularly promising methodology for estimating synthetic controls. I'm going to talk in detail about this augmented synthetic control method. This is a great version out there that's a basically doubly robust version of synthetic control, where it uses the weights that I just talked about in terms of making sure that our synthetic control actually comes up with a hopefully good match for the treated state, but it also fits an outcome model with those weights. And so this is doubly robust in the sense that as long as we get either the synthetic control weights correct or the outcome model correct, we can feel pretty good about having an unbiased estimate of the policy effect. And so this has been a really useful method. We've studied it a lot in our simulations, and it really does a great job at minimizing bias. So we are excited to share it with you so you can have it handy when you think about what methods to consider in your future analyses. Also conveniently, this particular methodology has in the same paper, they showcased how to do the doubly robust estimation, as well as that their version, this augmented synthetic control, can easily handle the staggered adoption case. So I'm going to go ahead and walk through code for both the case where we have a single treated state, as well as multiple staggered adoption treated states using the same case study data we've been using. So in order to use augmented synthetic controls, you need to actually install this aug-synth library from R. It's not available in the base package or the contributed package, so you actually have to go to the author, Eli Ben-Michel's GitHub page. But you can do this very easily with these 2 lines of code at the top. You just install packages DevTools and then ask DevTools to pick off this package. You're going to need a few other libraries to help get this working. And I will say that the authors have a really nice tutorial associated with their package, just like Callaway Santa Ana. And here at the bottom for our Stata users, we do want to highlight that you can do this, you can do traditional synthetic control methods using the synth package in Stata. So, okay, here's the basic core code you're going to use when you're using aug-synth. And in this case, we're going to start with the single treated unit states. So I have a single treated state. It's going to be Illinois, and Illinois is going to implement the standing order protocol policy in 2010. And as controls, we're only going to use the never treated control states. So we've excluded any of those other states in this particular analysis. Most critically, as with all the methods, there's little nuances you got to make sure we get right when you're coding it up. So here we want to make sure that the protocol indicator, the standing order policy, is only 0 or 1s, no fractions. And we also want to make sure we use this ridge regression for the doubly robust outcome model. That's what's recommended by the authors as their preferred methodology for that. We also want to make sure when we set this going that we turn SEM to true, because that actually says, please use the synthetic control weighting so that you actually end up with a doubly robust model. And you have the option to use unit fixed effects, which are, definitely are recommended in this model. So we're going to go ahead and include those so that we have state fixed effects in our models. This is an example of the output in tabular formation. I'll show you a pretty graphic right after this. But basically what happens what's really nice, right, is you're basically just going to hit enter, let this run pretty quickly, and then you're going to get this nice output for your case study data. Or if you run it with our data, you'll see this. And so basically what you have, is for each of the years from the implementation year and beyond, you'll see a point estimate for the policy effect in that year, and then 95% confidence intervals as well as p-values. And so for 2010, we're basically saying the instantaneous effect of the policy is probably about negative 0.72. And as we go out, say 5 or 6 years, the policy effect appears to be growing in size. Now, as with the other methods today, there's not a lot of statistically significant findings. But it's useful to understand what the output is going to look like. If you want to plot it graphically, you just have to basically plot the R object that you're fitting, which is really nice. And you'll end up with a graphic like this, where you've got time on the x-axis and you've got your policy effect on the y-axis. So, I guess ideally, we'd hope that some of these curves in the pre-policy periods were really close to zero, but they're not far from zero. So we can kind of feel okay about what's happening with the control states prior to implementation. And then basically after 2010, the year of implementation, we see highly variable estimates for the policy effect, just like we saw on the table, and of course a lot of uncertainty around those estimates for this particular case study. So next, I want to showcase how to use multi-synth if we have more than one treated unit. So this is going back to the original data set that Megan already showed you with Callaway Santa Ana. So here we're letting all of the treated states in, and so we have staggered adoption. And it's going to look highly similar to what we just saw. Some things to highlight here is that we do want to tell the package how many pre-period and post-period treatment leads and lags we want. So in this case, we set it to 8, so we can showcase those results for you, given we have that time available in our data. But you want to kind of choose it based on how long your time period goes and what you think your data can support. A lot of times it might overfit. If we ask for more, it might give us output, but you'll see there's a lot of variability around it. So it's good to think about how many leads and lags you might want to show. The other thing that's really useful is, given this is the multi-synth case, so we have multiple treated units, you can ask for it to produce a series of outputs for each of the treatment group cohorts. So basically, we'll see for different treatment years, we'll see what the actual synthetic control estimate is for those cohorts. And I think that's really useful just as you're kind of understanding what the data and what the story is being told by the data. So there's a bunch of different outputs. I think we're just going to kind of highlight a subset today. But first, one of the things you'll see is if you type summary, you're going to end up basically seeing a series of summaries, which is really convenient. It's the time varying effect, right? So it's basically going to say for each of these rows, this is the time since treatment. So at 0, this is basically like the instantaneous effect of the policy right after it's implemented. 1 is the effect of the policy 1 year later, 2 is 2 years later, and so on. And again, just like some of these other methods, here we're going to have an estimate for the policy effect. Now they've actually turned positive. This is the first set of positive results, which would say potentially increasing mortality, but none of it's significant. You'll also see standard errors and then 95% confidence bounds. One of the things I'm going to say with this methodology that is a struggle is the standard errors are often really high. We obviously are working in a very constrained environment, given we were talking about state policy analysis and we only have 50 treated states. But in general, methods like augmented synthetic controls in general, and even Callaway and Santa Ana, a lot of these methods really struggle with standard errors. And that's okay. It's kind of a transparent way to see the uncertainty in the data, but it is something we've seen in simulations as well as practice. So with that in mind, oh, first I want to showcase this graph. So the plot function here, there's a couple of nice options, but this particular one kind of puts everything on the table. So what's really nice is you've got the average effect post-treatment across all of the sample, as well as in this shaded gray, you've got the treatment cohort specific effects. So if we're showing results for 2010 treatment cohort, 2013, 15, 17, 16, and 14. So it's just a really nice way to kind of see all the variability you might have. So if there are cohort differences, early adopters might either be more or less effective. You should be able to see some of those findings in this type of analysis. So it's kind of a very rich set of results to be looking at. And then if you just want to look at the average effect, you just need to tell the plot to only read out the average, because that can be a lot cleaner, obviously. But I think it's always good to look at all of the available options. So I'll pause and see if there's any questions that.
Yeah, we have several questions in the chat, so I can read some out to you.
Thanks.
Yeah. So one question is, and we might punt this to later, but on choosing between traditional synthetic control and augmented synthetic control. Do you want to discuss that now, or do you want to wait?
Well, I think particularly, oh yeah, I don't have to go back. I think it's really nice to use augmented synthetic control because of the doubly robust property. But you give, yes, like Elizabeth was alluding to at the end, the last kind of half hour of this course, we're really going to talk about how to choose between the methods. And so we have a decision tree that you can use that might help point you in the right direction, as well as you can use our simulation tool to help you decide and see if there really is an added benefit to the augmented synthetic control doing the doubly robust piece.
And then one of the other questions, so in the AugSynth, we talked about using ridge regression, and I know that is what is recommended in the paper. Are there examples of using other is there, I guess, times when we would not use ridge regression?
I'm curious if Liz has any comment. I feel like I've studied that enough to know, because I've only used ridge regression in our simulations, and it does such a good job. It's a great question. I was just thinking like maybe in the paper they studied or showed this, but I don't remember.
Yeah, they go through in detail in the paper about the ridge regression, but yeah, I don't remember. And then can you talk about how in the synthetic controls calculate the confidence intervals and p-values, which I think is different between the standard and the augmented?
Yeah, right. I mean, so with the synthetic control methodology, you're basically, the way I like to think about it, similar to how I think about propensity scores, is that the weight is when you go to compute your standard errors, the standard errors basically become like a sandwich standard error and account for the weights. When you're doing an outcome, the doubly robust regression, you basically get the opportunity to continue with a weighted survey model that will incorporate the weights into the standard error, but now you have the kind of benefit from an outcome model to improve the precision. So it's kind of like I know that's not formulas, but hopefully that's into some intuition.
Right. Okay. And
thanks. Is that good for now? Or?
Yeah, I think we can keep going. Thank you.
Yeah, thanks. Okay. So just sharing. Okay. So now I want to present a series of slides about a method that we've been using a lot. It hasn't been as popular, but we continue to find promise with this method because it does such a good job with the standard errors. Because basically what it's saying is we're going to use a regression model to take advantage of improving precision in these analyses, right? Policy, as we all know, it's really difficult to estimate state policy effects. It's even more difficult as we start to get into effect heterogeneity and trying to estimate the time varying effects of these policies. And so one of the things we've found in a lot of simulation studies in both the opioid and gun policy space is that if we use regression, but put lags on the right-hand side, we can really improve the precision of our models without introducing a lot of bias. Now, immediately, our causal inference folks are probably the reason why this method isn't as popular is because it does involve putting lags on the right-hand side, which will basically introduce, time varying. You're introducing a time varying confounder that's captured sometimes after the policy treatment period, and that can definitely be concerning because it can introduce bias. But what our simulations have shown is the bias is not that big. So ultimately, it's a bias variance trade-off issue, and sometimes the wins for this model can be quite notable. So we want to talk about it today as another option to add to your toolkit. So basically, let me show you, this is what this model looks like. It's called an autoregressive model. And basically what we're going to do now that's slightly different from what Megan showed before for the diff and diff model is our outcome y I of t is now going to be regressed on a lagged value of the outcome. If it's an AR1, you'd only have a single lag, so it would be yi of t minus 1. And if it's an AR2, you'd have two lags and so on as you want to add more lags. And then critically, you'd have time fixed effects in, but not state. We've found the state fixed effects are not needed above and beyond the lags, because typically when we are thinking about modeling this type of repeated measures data like mortality or opioid mortality, the lags are so highly correlated that it's the most important kind of predictor. And so if you really, really like your state fixed effects, though, you can put them in. The big thing is kind of like you can put them in, but then you're losing all those degrees of freedom. And if your goal is parsimony, you don't have to. So I kind of say to people, if like you really don't want to let go of state fixed effects, it's fine. You can include them. But for me, I really like to try to use that extra degrees of freedom to control for different confounders I might be worried about. So there's some trade-offs here, but it's just an important nuance. The other nuance when you fit this regression model is that the policy variable shouldn't be coded in a traditional way. And this is one of the first mistakes I see when people try to recreate this model and on their own, is that we no longer actually want to use zi of t, the value at time t of the treatment indicator. Instead, because we are now we're basically modeling change in y, we need the exposure to also be on the change or first difference scale. So instead of zi of t, it's super important that the model has zi of t minus zi of t minus 1. And so that's just really, really important. The code today will make sure to have that change level in it, and just something to be aware of. Otherwise, we've found that if you code it with just zi of t, you can get pretty biased results. So it's important to be careful about that. Of course, critically, one of the first questions everybody asks is, hey, how do I even know how many lags to use? Well, since this autoregressive model, this is nothing new, right? This is the slide before I talked about it, where it's very similar to the family of ARIMA models, right? People are used to using lags to help with predicting future values. And so there's actually a wealth of different tools you could use to try to figure out how many lags are useful or needed in your own data. The one that I like the most myself, just because it's kind of easy and gives me, a quick answer, is this partial autocorrelation plot that's shown on this graphic, where on the x-axis, you basically have the number of lags being included in the model. Here we go from 0 all the way to 8. But then on the y-axis, it basically plots this autocorrelation given lag k that hasn't already been accounted for all the lags prior to k. And so in our data, we see really clear evidence that one lag is enough. Like once you try to control for the second, third, fourth, and so on, it doesn't add a lot. So really the single lag in our case is the most useful. And I can't guarantee that this will be the case for every repeated measures data, of course. So it's really important to do a diagnostic like this before you actually go to estimate your models. But once you figure out how many lags, then now I can show you the R code for doing this part of it. Basically, here's, you have to do a series of kind of data cleaning steps before you fit the regression model, though the regression model itself is super easy to fit. And let me showcase, sorry, I keep having little difficulties with advancing. Okay, so in this code, what I want to highlight for you first is that it shows you how to use the lag function in R to generate lagged values of your outcome, as well as the needed lagged value of the treatment indicator, so we can compute the change coding. So those are important snippets of code to help get the data ready. And then this last line of code is particularly useful just because it helps you generate that change coding. It's basically going to take the standing order policy variable we've been using in all the other models, which is 0 and 1, 0 pre-implementation and 1 post-implementation. And then it computes a change code version by subtracting off the lag. So in our case, that's basically going to become 0 for all the pre-treatment periods, 1 in the year of implementation, and then 0 in the post-treatment years beyond that, given the way this data is structured. But I guess I was just thinking on that, if you have fractions, this still all is needed, because it'll basically, like if we did, you know, say a half for 6 months of implementation, then this type of change coding would be 0, 1/2, 1/2, 1. So it can handle fractions, which is actually my preferred way of modeling the data if you do have your policy information down to the months. Then in terms of the regression itself, it's pretty easy. You've just kind of got a classic R regression model here where the outcomes on the right-hand side. And then most critically now, in difference to the model shown before, we've basically got a policy change. We've got the policy change indicator and then the 1-year lagged outcome value. No state fixed effects, but I still have year fixed effects and the unemployment rate. So right now, this particular model is just, it's not allowing for time varying effect heterogeneity. So I'm going to show you that in the next few slides, but this is just assuming a constant effect. And if you run this, this is the output you end up with, where you just kind of, it's a classic regression model output. You've got your policy change variable, your lag, and my year fixed effects, as well as unemployment all the way at the bottom. It gives us a bunch of regression estimates in this case, because we're just doing linear models right now. Again, mainly because we use simulations to find out linear models are good here for this particular outcome series. And then, you know, standard error, t-values and p-values. So in this case, if we just look at the non-time varying effect of the policy variable, the standing order protocol, we basically say there's, you know, a negative effect that's kind of small, and we've got a p-value of about 0.18. So this is, like I had said, it increases precision a lot. So this is probably one of the more almost like marginally significant models we've had today. But that is also kind of, it can be a problem sometimes, because that basically can make the coverage rates for this models way too low. So there's trade-offs just like all of these. And so sometimes those gains might not necessarily be needed. So the other thing I want to say before passing the baton or answering more questions, hopefully, is critically, we really actually like to fit this model with the event study specification that Megan went through before, because it's really true that most of the time folks are really interested in estimating the time varying effects. So you want to know, you want to see output for the instantaneous effect, the effect after 1 year of implementation, 2 years of implementation, and so on. And so we can use the same, we can use the event study specification added into this model in addition to our lags and the policy change variable. So in order to do that, here's the code, and I'll just highlight that what it's actually doing is, first, it's basically needing to generate treatment year as the year of adoption for all the states that implemented, or negative infinity if you're a control state. So it's just using an if-else statement, like if you're in the treated, then make your treatment year your actual treatment year. And if you are not a treated state, then I'm just going to give you negative infinity. Once you do that, you're going to use that variable to then generate our pre and post treatment period leads and lags. So this next set of code at the bottom to create this TST variable, which is just the year of the data minus the treatment year, will give you both negative and positive values depending on what year that row is representing. So once you've done that kind of those data steps, what's really nice is you end up with output that looks more similar to what we've been seeing for synthetic control in Callaway Santa Ana, where you get a series of time varying effect estimates for the policy variable. So what we see here is, the instantaneous effect at 0 is basically negative 0.27. We're not seeing much significance. And we see some positive estimates still, but all very, very, very small, and not a lot of significance till you kind of move out into the later years. This has actually been found, I think, across several of the methods, that there seems to be a pretty large effect in that last year from that smaller cohort. But overall, I still wouldn't buy. We're not going to overinterpret one positive result or one significant result along the way. But this is a useful way to really fit this autoregressive model so you can get time varying effects. And we are doing a series of simulations right now to study how these models are doing versus each other. So we'll talk a little bit more at the end about how to use simulations to help you understand which model's best. Are there any questions I can answer now?
Yes, I will try to ask while I also switch over. So one is, if they're using a count outcome, should the lagged outcome be a count or a rate?
Yeah, that's a super good question. Interestingly, we've actually found the rate is the most useful predictor. I've done this in both gun policy for total firearms mortality and in the opioid space. And in both cases, it was the actual control covariate of the lag was the rate, even though, like with the gun policy count data, we modeled it as a negative binomial, but the actual version of the lag was the just raw rate. So I would say that's something to study in simulations, ideally, like I'll say at the end, just to kind of help you, because it's also been super interesting that different models were better. I mean, this is not surprising, but different outcome models were more useful for gun policy outcomes than, different models for different outcomes, basically. If it was total firearms, we needed to use a negative binomial. If we were model opioid related mortality, we needed to use linear regression. So it's really important to do the kind of simulations I'll present at the end, if you can, with your own outcome data, just to know what's best.
Great. I think that's the only other one I saw on autoregressive. We have some answers in the chat. And can you see the ITS?
Yeah, so it looks great.
Perfect. All right. So I will be closing out this section on analytical methods, focusing on interrupted time series, or ITS, and an extension of ITS, the comparative interrupted time series, or CITS. So similar to the other methods we've been discussing, ITS uses longitudinal data to look at changing outcomes over time. And where ITS kind of in its classic form is unique is that it does not have a control group. So you only have a pre and a post in the treated group. And so one example of where a lot of recent ITS designs have been used is in looking at changes in outcomes related to policies that were implemented when COVID hit in 2020. And so for federal policy changes, especially, everyone kind of experiences that policy at the same time, so that there's not necessarily a control group, but ITS can be used to look at that pre-post change. And the underlying assumption here is similar to the other methods, where we're assuming that both the level and the trend over time observed before the policy interruption would have continued into the post period if not for that interrupting policy event. And as I mentioned, there are also variations on that classic ITS pre-post no control group design. And if you include CITS, which adds in a control group, and which we'll discuss in an example, and other extensions include multiple baseline design, where there's kind of staggered interruptions, so multiple baselines to look at differences. and also an ABA design where an intervention or policy is introduced, taken away, and then introduced again, which again allows for multiple interruptions, multiple baselines to assess change in outcomes. In terms of the actual models, the basic ITS model at the top is fairly straightforward. So we include variables for time, a policy indicator variable, and then new to this method is a measure of the time since policy implementation. And so this variable will be 0 before the policy and at the time of policy implementation, and then will be continuous moving forward. So you would have 1 year post, 2 year post, 3 years post, etc. And you can also include any covariates. And then we'll be including state fixed effects and clustered standard errors to account for the repeated observations within states over time. Kind of as Beth Ann had alluded to with the AR model, there are other methods for accounting for this correlation. One example is an ARIMA approach, which is another autoregressive model, but we're presenting the state fixed effects as a more kind of simple, straightforward example. And then the CITS model builds off of that original ITS and adds in an indicator for treatment versus control. So remember the ITS was only treated units. Now we have a control group. And then that treatment state indicator is interacted with our other variables of interest. So time, post period, and the time since policy. And I'll also highlight here in the CITS model that post-period variable is a renamed version of the policy variable because we want to indicate pre versus post-period in both the treatment and control groups, not just the treatment group. And then again, you can include covariates, and we'll be including state fixed effects and clustered standard errors. So going through the R code here, for this example, we will just be using the 2014 treatment cohort. So we have a single interruption and no control group, but there are multiple states in that 2014 cohort. And so we're initially generating that new time since policy variable that is 0 until the first time point after implementation. So in this case, 2015 is where we start the continuous count after the policy implementation. Then we have a pretty straightforward linear regression model, and we're including the indicator for the policy, which will turn on in 2014. Our time since policy implementation variable, which again is 0 up through 2014, then 1 in 2015, 2 in 2016, etc. And our state fixed effects, because we have multiple states that all implemented in 2014. And this is the code where we're indicating that we're clustering our standard errors at the state level to account for the correlation in the repeated measures over time. So in our model output, we have 2 coefficients that we're interested in. First is this policy indicator variable that switches on in 2014. This gives us the change in level or the change in intercept at the time of policy implementation. It's kind of an instantaneous policy effect. And we can see here that this is showing a small, not significantly significant difference in overdose deaths at the time of policy implementation. And the second coefficient we're interested in is that time post-policy implementation variable, which is showing the change in trends or the change in slope after versus before the 2014 policy implementation. And so here we are actually seeing a significant increase with a significantly steeper slope following policy implementation. And what's really nice about ITS and CITS is when you're able to see these results visually. And so we have the results graphed here, and the code for this graph is included in the supplemental material. And we're able to see in this plot the observed outcomes and the counterfactual that we're comparing to in the post period. So in the solid lines, we have the actual observed level and slope that comes from the period, and then in a dotted line between 2014 and 2017, we continue that line, and that's what we would have expected to observe in the absence of policy implementation. And I want to highlight here, especially since it's showing a significant increase in overdose, that this is not actually the method we would want to use. We do have control data. And so now let's look at the CITS approach where we can add in that control state data. And so for this example, we're continuing to only use the 2014 implementers. So we have a single time point of policy interruption. But we're adding in the states that are the never implementers as our control group. And so we are again generating that time since policy implementation variable. And we're also creating a time invariant indicator for treatment state versus control state, and a pre-post variable that's used in all states regardless of treatment status. So here's our linear model. We again have that time invariant treatment state indicator. And we're interacting that indicator with our other key variables. And just a note on the R code here, when we include the interaction between the two variables with the asterisk, it also includes the individual variables as well as that interaction in the model, similar to the pound sign and stata. And so this just saves some typing, makes the model code a little cleaner. And highlighting the rest of those key variables, we have our pre-post treatment indicator and its interaction with the treatment state variable, our time since treatment variable that we had also in the ITS model, and its interaction with the treatment state variable. And then again, we're clustering standard errors at the state level to account for the repeated measures over time. And again, in the model output, we have two covariates of interest. And here it's going to be similar to the difference in differences, if you recall that Megan talked about at the beginning of this section, where we're interested first in the change in level at the time of treatment states, comparing the differences between that change among treatment and control states. And so we see here that we have a non-significant difference on that interaction term. And then secondly, we have the change in slopes pre versus post, comparing the change between treatment and control groups. And so again, we're looking at the interaction. And when we include that control group, we can see that this change now is no longer significant as it had been in the ITS model. And again, using code that's provided in the supplement, we can make this nice graph where we have our observed data as well as our counterfactual. And in this case, the CITS model projects that the change in level and slope in the treated group after the policy, so that dotted line, would have been the same change as in the control group after the policy, if not for the intervention. And now I'm going to hand it back to Megan, who's going to transition us into the next section of this presentation.
Thank you. Let's see. Okay. I think I have my slides up. So now we're basically moving to part 2 of this workshop after going over all these different sets of methods. You're probably left wondering, well, how exactly am I going to choose what methods to use when? And so basically the remaining 2 parts, first I'm going to talk about a decision tree framework that basically will help kind of conceptually sort the methods in terms of which methods are applicable in which kind of generalized contexts. And then, as you'll see, that may yield a set of multiple different methods that could be applicable in any given setting. And then Beth Ann is going to end by talking about our simulation tool that you could apply to your actual real life data and compare the performance of methods in a given case to give you more insights in terms of performance and an actual, the contours of your actual data, which could help further refine your choice. So to start off, again, here we're going to be focusing on some key conceptual differences across methods. And so one kind of differentiation here is whether or not you have a control group. And so as we just saw from Elizabeth, if you do not have a control group, then standard interrupted time series model be applicable. But if you do have a control group, then basically any of the other methods that we have talked about so far would be applicable. Additionally, another key factor is how many treated states do you have? And so if you have only a single state, recall that synthetic control methods or augmented synthetic control both only allow a single treated unit, single treated state. Comparative ITS or interrupted or standard ITS, again, as Elizabeth just highlighted, you can have a singular treated cohort like all of the states that adopted in 2014, but you're limited to a single cohort. If you have multiple treatment states, then your potential options include classic diff and diff model or any of the kind of new modern diff and diff extensions, autoregressive model, synthetic control method extension for multiple units, or ITS with multiple baselines. Another key factor is what type of policy treatment adoption do you have? So do you have simultaneous adoption in which all the treated states adopted the intervention at the same time, or do you have that staggered adoption case that we talked about that's, again, very common, in which treated states are adopting interventions at different time points? So for simultaneous adoption, you can use the classic diff and diff. You can use synthetic controls or augmented synthetic controls, an autoregressive model, or an ITS or CITS model. And if you have staggered adoption, then you can use the following. So an autoregressive model, recent diff and diff methods for staggered adoption, multiple baseline ITS design, or synthetic control methods extension for multiple units. And highlighting here that using a classic diff and diff or ITS models may give biased effect estimates in the case of staggered adoption. And then the final point to highlight is around potential effect heterogeneity. So are you anticipating that your policy effect has some heterogeneity, either with respect to time, so dynamic treatment effect, or across cohorts of policy adoption? So if you have dynamic treatment effect, then potentially consider a synthetic control model, or Callaway-Santana, or the other heterogeneous effects diff and diff methods that will estimate dynamic treatment effects. Also highlighting here that through the use of interaction terms, you can also obtain dynamic treatment effect estimates from some of the other approaches. If your concern is a cohort treatment effect, then you should be thinking along the lines of either synthetic control method extension for multiple units, again, Callaway, Santana, and some of the other new diff and diff methods will provide estimates of cohort specific effects. And again, you can always, kind of manually stratify your data and apply some of the other methods to obtain cohort specific estimates. So now I just want to kind of apply this conceptually again to our overall case study. So again, we're still here with the standing order naloxone laws and reminding you of the cohort structure that we've seen before. And so decision one, quote unquote, is, do you have a control group? So yes, we do have control states here. So we're going to eliminate from the list using an interrupted time series model. And then we're going to kind of walk through these cumulatively to see kind of the final set of methods that would be conceptually applicable here. And so then the next point is, how many treated units do you have? And we have more than one treated state and more than one treated cohort. So here we're crossing off synthetic controls, augmented synthetic controls, and CITS. And then turning to treatment adoption, here we have a case of staggered treatment adoption. And so we're going to cross off a classic diff and diff approach. And then concerning potential effect heterogeneity, we're going to say we possibly may have heterogeneity either across time or cohorts. And so here, crossing off multiple baseline ITS because kind of the standard issue version is not does not yield does not estimate heterogeneous treatment effects. And so that leaves us with modern diff and diff approaches, including Callaway-Santana and the autoregressive approach, as well as synthetic control methods for multiple units. And I will pass the baton to Beth Ann.
Successfully share.
Yep, looks good.
Okay, so so now we basically have these three different methods that could be useful for our case study data. So I want to end this workshop by talking about how we can use simulations to help us choose between the set of methods that you still have left after using this hopefully helpful decision tree framework to work through and chart which methods are going to be most useful for your given case study data. So as noted, this last section is going to share a simulation tool that we produced during our first 5 years of funding under our center grant to try to help researchers understand which methods might be optimal when they're interested in evaluating policies. Take a sip of water. So as part of our work, we developed an R package that is basically able to be used on any user provided repeated measures data. And what it's really helpful to do is basically allow you to put a couple methods into the simulation study, depending on what you're interested in studying the relative performance of, and helps you understand for your given data what might be useful. And this can go down to just even the core questions of, should I use a linear Poisson or negative binomial if you have count data? So there's lots of different things you can use the package for. The user has a variety of different scenarios that can be studied. We've got no confounding, confounding, and we have the ability to put in multiple policies so you can see which method does the best at disentangling policy effects when you have more than one, which is obviously much more reflective of what is happening in practice. So we hope folks start using it, and we'd love your feedback if you do use it on your own data, and if you get stuck, let us know. We're happy to help. So in trying to do a simulation using the repeated measures data, you basically have 5 core steps. Obviously, in the first step, you're going to load all the needed packages and your own data. Then in step 2, you're going to specify which of the methods you want to test. And today we'll test the 3 that we identified using the decision tree framework: Callaway, Santana, augmented synthetic controls, and the autoregressive model. In the third step, you're going to configure the simulations you want to run, all the different scenarios you want to study, whether how many treated states you want, whether you want to have confounding or no confounding. You'll make those types of decisions. In the fourth step, you'll let it run. And then in the fifth, where you'll spend the most time, you're going to review and compare the results and hopefully decide which one or two, or sometimes they tie, but you'll be able to see which methods are best for your data using these simulations. So we're going to continue to use the same case study data for our simulations today in order to understand in this particular case set of data how which method is showing up as optimal, or which methods are showing up as optimal. So the first thing, of course, you're going to need to do is install our Optic package. The Optic package will continue to grow. We just got additional 5 years of funding from NIDA, and we're excited to expand the package to, we're basically going to be studying all different ways of having effect heterogeneity, and so you can kind of see that we will add to the package as we build out additional simulations that look at different types of effect heterogeneity. Obviously, time varying is coming soon, and we'll look at things like which methods do the best at handling and identifying heterogeneity by state factors or county level factors. So there will be a bunch of rich work to help grow this particular package. In addition to once you install it, you want to load Optic, but you also need to load any other library that might be useful. So obviously we need diff and diff for Callaway, Santa Ana. We're going to need AugSynth to get our augmented synthetic control methodology in here for multiple treated units. And then we need a few other things here just to help us with estimation. In step 2, when you're specifying the models, I'm just going to showcase here the 3 that we came up with as needing to be tested for this case study data. The package really can support any type of linear account model regression, any type of regression model you'd want to fit, because you just use the typical regression language to get it to run. And it can do the lagged autoregressive models, Callaway, Santa Ana, and augmented synthetic controls. But we're adding new methods, let's say kind of monthly. So I'm expecting the next iteration of the package to be able to handle a lot more of the new methods, because this is a very rich area, and I know there's new methods coming out. Even somebody sent something today. So lots of new stuff. We're keeping an eye on it, and we try to make sure that the package has a lot of versatility. If you have a favorite method and you want us to look at it, please send it to me so we can study it and add it. So in terms of the code for specifying your models, here today I'm showing you what type of code snippet is needed for the single lagged AR model, which we found was the single lag was enough for our data. I'm going to show you augmented synthetic control in purple. And then on the next slide, you'll see the code for Callaway, Santa Ana. And just a few things I want to comment on about how the package likes to operate. You as a user need to give it a short name. That's going to be very helpful when you get all of the output. So like AR is going to stand for autoregressive. ASCM is augmented synthetic control here for multiple treated units. And that's just useful for later. The other thing I want to highlight is that the package allows you to use the conventional R formula for doing a regression model. And so you really can put, in this case, you know, I've got the unemployment rate in there as an important confounder. I've got time fixed effects. You could add state fixed effects if you wanted. You could study models with and without state fixed effects to see how much the state fixed effects add. So you can study a lot of different things, or put different types of confounders in depending on what you have available and what you want to study. So that's kind of a nice feature. The other thing that's really important if you're using a regression approach is you can tell us what type of clustered standard errors to produce. This isn't really relevant for augmented synthetic control or Callaway, Santa Ana, But it's useful if you're going to do a classic two-way fixed effects model. You would always want to have clustered standard errors. And for the autoregressive model, it's interesting from the papers that were shared earlier, the simulation papers, we've consistently found that clustering actually can mess up the standard errors in the autoregressive model. So in fact, the optimal autoregressive model is actually not to include standard errors. Otherwise, you can get some instability. So that's just a subtlety to that model. But the cluster adjustment options are in there for any other model you're fitting if they don't have lags in them. Now, once you've said, you know, how, if you want to be very, you could, I think in our latest simulation, Max Griswold probably put like 8 different methods in. So you can run this with as many methods as you want to code up. But then when you get to actually configuring the simulation, there's a couple of nuances I want you to notice for this command, which is the big, you know, this is like the heart and soul of the optic simulation setup. So first, of course, one of the things you have to figure out is what type of policy effect sizes should we choose? And the thing that we found most useful is to actually use the raw data to help you understand what, say, like a 5 or a 10 or a 25% effect might be. So in this case, we're going to test and look at output from a 5 and a 10% policy effect, because generally speaking, those are things that are pretty actionable for policymakers. They usually would correspond to thousands of lives being saved. And we know that the higher we go, the better the models are all going to do. So we like to try to figure out and spend time on thinking about what is the most meaningful policy effect to try to see how the models do handling. We've found, you know, somewhere between 5 to 15 is probably the right realistic range to go for. So then the other thing I want to say within the optic simulation object itself, I'm going to point out a bunch of important things. You got to give it your data set. In this case, our data is the overdose data from today. You want to list the models that you've already specified. So we've got autoregressive, the synthetic control method, and Callaway-Santa Ana here. You also want to tell it how many iterations to run. When you first do it, please use 2, just to make sure that you get any bugs out before you run it a long time and maybe see an error. But 100 is usually a pretty good one to be able to look at results and feel confident about some of the estimates, particularly around like type 1 error or power, or sorry, coverage in this case. Then importantly, you get to tell it which of the scenarios to run. So right now in the current package, we have no confounding, which we'll do today. It's just the simplest one. Obviously, it's just the treated states will be randomly selected. There's no systematic differences. So really, these methods should hopefully do a pretty good job. But you can do confounding. And if you choose confounding, then the package will build in systematic differences between the treated and control states. And that's really great. You have to do some work to tell it, you know, what the parameters should be for the confounding model, which in and of itself can be very nuanced. But what we hopefully can provide some guidance where you basically can study like the impact of, say, small, medium, or large confounding on your models. So that's a useful scenario to utilize. And then the co-occurring one is also really useful if you have multiple policies you're going to analyze and you want to know which of the models is best at teasing out policy effects. And it'll also help you understand how close together the enacting policies being enacted can get before your model starts to fall apart. This is going to continue to grow. So our next update will be the time varying effect heterogeneity option. And I'm really hoping that will come out within the next few months, hopefully over the summer. Okay, other things to point out, effect magnitude is, I've actually created a vector above of the 5 and 10%. So that's actually a vector. So we're going to have 2 different scenarios examined. We're also going to permute that by testing different types of sample size. In this case, it's always going to be 50 treated states because that's the data set. But we're going to have a series of runs with only 5 treated states that implement the policy, and then a series of runs with 30. Obviously, 30, the models will hopefully do better, usually do better, and 5 will be the most challenging scenario. You also want to tell it which direction the effect should have. Here we do negative because it's mortality data. So in the ideal scenario, policies would be helpful and reduce mortality. But you can do null, you can do negative or positive. You can set it up to explore all of those options. You'll just, you know, as you expand the number of options, you're expanding the amount of output that you're going to analyze. But there's a lot to be studied in this setup. And then importantly, the package will also let you understand how the models do depending on the assumed type of effect your policy has. So here we have two key scenarios. Instant is just saying there's an instantaneous additive effect, so there's no effect heterogeneity. Slow is basically saying that the effect takes a certain number of years to actually get to its full effectiveness of 5 or 10%. And in this case, we said, let it be really slow. Let it take 6 years for the law to be fully effective. So this one kind of, even though we don't have full time varying yet, this is one way to study how the methods do. Instantaneous models, usually what I've seen is models do better with the estimators do better if it's an instantaneous effect than slow. But it's another feature that I hope folks find useful. Conveniently, once you've set up your configuration, since this is such an important part, the package before you hit dispatch is going to basically give you this summary box in orange and say, hey, this is what you're about to ask me to run. You're going to have 8 different scenarios. You're testing 3 models and you're asking for 100 simulations per iteration. So that's 800. It's just a good way to kind of make sure that you programmed everything up correctly, ideally before you run things rather than after, because it can take a while depending on how much you want to run. Now, in terms of dispatching things, I don't even need to spend a lot of time on this. This is a pretty ugly but needed command. When you run it, the most important thing I'll say is it will continue to update you as it finishes each of the jobs. So we have 8 jobs it has to do, and you can kind of see, okay, well, the first job is the smallest effect magnitude of 5%, the smallest number of treated states, and the instantaneous version of the code. So as it builds, it'll vary based only those 3 things, given those are the only ones I wanted it to vary over. So conveniently, you can go get coffee, you can go have lunch, check your email, whatever you need to do. Depending on how demanding you are, it could maybe take a whole day. But hopefully something like this should be able to finish in under an hour, what we've asked it today. Then where you're going to spend most of the time is on reviewing the results. So at this point, these results are huge. So I've actually only outputted a small snippet from the instantaneous case with 5 treated states and the 5% policy effect, just so you can kind of get a sense of, we can talk about how to interpret the output without thinking about every permutation. And so what I'm showing here also is a subset of the number of metrics that you can look at. If you do a null run, things like type 1 error will be produced. In this case, this is a non-null run because we have a 5% effect of the policy. So I just decided to share, the average estimate that's coming out, the model standard errors, which are useful to see how well the model-based performance is for standard errors. We're showing bias, coverage, and then the MC variance across the simulations, and finally MSE. So interestingly, I think most importantly here, across all of our core metrics, the augmented synthetic control model is really doing great with this data. The bias is pretty low at 0.9. I realize it could be more useful to present this on like a standardized effect size scale so we understand if this is really that big. The point estimates don't seem that far away from a 5% effect, so that's probably, they're not doing that bad. There's not a lot of bias here for any of these. But the coverage is interesting. The coverage for like autoregressive model is really bad. I think it's basically the model standard error is just so low that it's estimating the effect, the biased effect really well. So that's not good for the autoregressive model in this case. But in terms of the MSE, you definitely also will see support that augmented synthetic control does well. And so in this case, I feel like it really does kind of come out the clear winner. That has not always been the case. So, this one simulation shouldn't be used necessarily to say that augmented synthetic control would always be the clear winner, just because these methods have their value, their merits in different places, and sometimes one wins and sometimes the other wins. And for Callaway Santa Ana, I do want to emphasize that this really isn't a fair comparison right now because we're looking at the aggregate treatment effect rather than the time varying effects. And Callaway Santa Ana was really designed to get at heterogeneous treatment effects. So, you know, our next set of simulations that's going to come out soon will showcase how these models are doing at estimating time varying effects. And that extension will be built into the package very soon. So we're excited about that as well. So just going to the next set of results then, based on that, if we go back to our simulation study, I guess officially we probably should only be showing the results for augmented synthetic control. But since we still kind of had these three methods and I didn't do all of the exhaustive simulation, I'm just showing you a quick summary of the aggregated policy effects from each of our three leading methods that came out of the decision tree. Where, like we talked about, you know, I think some of the things the simulation showed and are supported here is like the model-based standard error for the augmented autoregressive model does it's really low, but potentially very much at the sake of losing coverage. And so that's not necessarily a good win on this one. Augmented synthetic control has a pretty high standard error, Callaway Santa Ana as well. That's happening with these methodologies because when you really look at estimating effects for each of the treatment year cohorts, the sample sizes are so constrained. So these model-based standard errors make it really tough in practice to necessarily come up with you know, highly significant results. But I'd also say that these results are not necessarily surprising right now, given we are in an era of rising fentanyl, and it's just really difficult to actually see policy effects that decrease mortality right now from different types of drugs. So as we close, I want to say, like, perfectly on time, I do want to say thank you for coming. I hope that today, I know we threw a lot at you in these 2 hours. I think what's been so fun about being a part of our center for the last several years, 5 years now, going on 6, is there's so many amazing methods out there, and there's so many wonderful methodologists doing work in this area. So that helps us as policy researchers and statisticians or economists, like, it helps us be able to know that we have a lot on the table that we can use. So hopefully, you know, as you saw from the end of this course, we wanted to give you some guidance in terms of how do you actually decide between all of those rich methods. And I think this decision tree framework should hopefully be a great way to ground how to walk through your data in a first pass to try to figure out which of the methods work. That is going to be a paper that we will also put out soon. Megan and Elizabeth are leading that. And I was going to say that our hope is to submit soon. And once we submit, we'll put it on archive and we can share it with you guys as well who attended the course. And then we're going to continue to build out our simulation tools so that it can handle more types of effect heterogeneity over this renewal period for the center. So we're excited about all of that. I hope everybody enjoyed today and want to thank you for giving us your 2 hours.